Have you ever wondered about the precise process doctors follow when investigating complex neurological symptoms? Doctors confirm a multiple sclerosis diagnosis through a careful, multi-step clinical process. It is not a single test, but rather a collection of findings that collectively point to this specific condition. The goal is to identify distinct areas of central nervous system damage occurring at different times, while also ruling out other conditions that might mimic its symptoms. The reason this approach is so thorough is that multiple sclerosis is characterized by damage to the protective covering of nerve fibers in the brain and spinal cord. This damage, called demyelination, disrupts communication between the brain and the rest of the body. Since these disruptions can manifest in many ways and can come and go, doctors use established diagnostic criteria, like the McDonald criteria, to ensure accuracy. These criteria look for evidence of lesions in at least two different areas of the central nervous system, occurring at least 1 month apart. So how do doctors put this into practice? First, your doctor will conduct a comprehensive neurological examination. This includes evaluating your vision, balance, coordination, reflexes, and muscle strength. They will also take a detailed medical history, asking about any symptoms you have experienced, how long they lasted, and if they improved or worsened. You can prepare for this by keeping a diary of your symptoms. Next, a crucial step is magnetic resonance imaging, or MRI, of your brain and spinal cord. This advanced imaging technique uses strong magnets and radio waves to create detailed pictures, allowing doctors to visualize the characteristic lesions or plaques associated with multiple sclerosis. These lesions are areas where the protective nerve covering has been damaged. Sometimes, a special dye is used to highlight new or active lesions. You might also undergo evoked potential tests, which measure the electrical activity in your brain in response to specific stimuli, like flashing lights or sounds, to check nerve pathway delays. Another important test can be a lumbar puncture, often called a spinal tap. During this procedure, a small amount of cerebrospinal fluid, the fluid surrounding your brain and spinal cord, is collected and analyzed. Doctors look for specific proteins, such as oligoclonal bands, which are indicators of inflammation within the central nervous system. Finally, blood tests are always performed to rule out other conditions that could cause similar symptoms, such as vitamin deficiencies or certain infections. This diligent diagnostic pathway, guided by neurologists who specialize in conditions like multiple sclerosis, ensures that the diagnosis is as precise as possible. It is a rigorous process, but one that has evolved significantly, thanks to advances in imaging and our understanding of the disease. This thoroughness helps differentiate multiple sclerosis from other neurological disorders, paving the way for targeted management. Ultimately, understanding this meticulous process can empower you as a patient. A confirmed diagnosis provides clarity and opens the door to effective treatment strategies and therapies designed to manage symptoms, reduce relapses, and improve your overall quality of life. It allows you to work closely with your healthcare team to develop a personalized care plan, fostering well-being and proactive health management.